flumazenil, rhamazicon, annexate, mazicon. Those are the trade names by which flumazenil is sometimes known. Flumazenil is a benzodiazepine competitive antagonist. Its clinical use is in the treatment of suspected benzodiazepine overdose. Typical formulation is 0.1 milligrams per ml or 0.5 milligrams in a 5 ml bottle. Mechanism of action. Flumazenil is a competitive benzodiazepine antagonist that binds competitively to the GABA receptors and reduces the CNS effects produced by the interaction of the GABA receptor with a benzodiazepine. As you can see in this animation, when midazolam acts on the GABA receptor, and the GABA acts on the GABA receptor, it opens the channels and allows chloride ions to enter the cell, causing a hyperpolarization and causing the CNS depressant effects. When benzodiazepines, in combination with other drugs used for pain management such as opioids and induction agents, the combination of these drugs can potentiate the sedative effects, the hemodynamic effects, and the respiratory depression seen with combination of benzodiazepines and other agents. How flumazenil works is it competitively binds to the GABA receptor site that midazolam or other benzodiazepines would like to bind. The inability of the midazolam to bind to the GABA receptor does not allow the GABA receptor to open and let the chloride ions into the intracellular component of the cell, thereby decreasing the CNS depressant effects seen with benzodiazepines. Typical dosing for flumazenil is 0.2 milligrams per minute with a maximum of 1 milligram in 5 minutes or 3 milligrams in 1 hour. This chart demonstrates the effects of dosing with flumazenil. Doses of approximately 0.1 milligrams to 0.2 milligrams produce partial antagonism, whereas higher doses of 0.4 to 1 milligram usually produce complete antagonism in patients who have received the usual sedating doses of benzodiazepines. The onset of flumazenil is 1 to 2 minutes. Peak effects occur in 2 to 10 minutes. Duration is 45 to 90 minutes. Flumazenil is metabolized hepatically and excreted renally. Flumazenil was studied in 4 trials in 970 patients who received an average of 30 milligrams of diazepam or 10 milligrams of midazolam for sedation, with or without a narcotic, in conjunction with both inpatient and outpatient diagnostic surgical procedures. Flumazenil was effective in reversing the sedating and psychomotor effects of the benzodiazepine. However, amnesia was less completely and less consistently reversed. Also, it is important to note that there is no effect with flumazenil on the analgesic properties of opioids. In general anesthesia, flumazenil was an effective reversal of sedating and psychomotor effects, just as like seen in the sedating considerations. Amnesia reversal was also unlikely. In the patient studies, patients were unable to recall Pictures presented to them after the administration of flumazenol. When the patients arrived in the post-op recovery room, they were not able to recollect the pictures that were given to them, that were shown to them after the reversal of flumazenol. Again, it is also important to note that there is no effect on the analgesic properties of opioids with flumazenol. Unique characteristics. Flumazenol is effective in the suspected benzodiazepine overdose. Flumazenol does not have any effect on sedation due to opioids, induction agents that are not benzodiazepines. Examples of these drugs would be your thiopental and propofol. In conjunction with a TCA overdose, there is an increased risk for seizures and cardiac dysrhythmias with flumazenol. Because the half-life of a benzodiazepine is typically longer than the half-life of flumazenol at 45 to 90 minutes, the patients must be monitored to check their level of consciousness and vital signs to make sure that the patients remain hemodynamically stable. In addition, going above the prescribed doses of flumazenol produces no additional effect. Also, it is important to note that by blocking the CNS depressant effects of benzodiazepines, the patient may become agitated, anxious, and can also place the patient at increased risk for a seizure. Here are resources that discuss, or pamphlets that discuss, the effects of benzodiazepines and flumazenol. Here are the references for flumazenol. Thank you.